REACH is very important to the health of our nation in that it shines a light on those communities that experience a disproportionate burden of largely preventable conditions. The REACH program was created in 1999 in response to a bold goal of Healthy People to eliminate racial and ethnic health disparities. REACH was created to challenge a long-held view that racial and ethnic health disparities were intractable. But in fact, we understood that it wasn't that it was a problem that we could not resolve, but we needed to come at it from a comprehensive, community-driven, and culturally tailored perspective.
REACH came to our division in 2016 in a transition mode, and we were honored to get such a well-respected program regarding health equity. We integrated the program into our existing efforts to address health disparities across the country, while still creating a space for the uniqueness and the rich history that REACH has in our division. REACH aims to improve health across the country and reduce the burden of chronic disease, especially for those individuals who have the highest burden of the disease, and they are the most vulnerable. The key point of REACH is that that work is done through communities and through community engagement, where the voices of those who actually are experiencing the greatest health risks are part of the solution. Despite decades of work to reduce health disparities, they still exist, and in fact, they're getting worse for some populations.
Health disparities are differences in health outcomes and their causes among groups of people. Health disparities typically reflect differences in where people live, where they learn, where they work, where they play, and how those that social context either sets them up to experience a greater burden of a health problem or not.
We were supported through REACH to help the Place Matters initiative, which is an effort to help understand the importance of place for health, the places where we live, work, study, and play. So the REACH grant was very important to help support the infrastructure and training of our leaders working in the Place Matters initiative.
REACH communities have seen decreases in smoking, they've seen increases in fruit and vegetable purchases, they've seen decreases in obesity, they've seen better control of hypertension, they've seen increased access to physical activity for their community members. In fact, between 2014 and 2018, 2.7 million more people had access to good nutrition. 1.3 million people in the REACH communities had improved access to physical activity. 770,000 people across this country had better linkages to their healthcare system to address their diabetes and their hypertension. And 650,000 people had environments improved for tobacco-free living.
So it's important that we put communities in the driver's seat to help lead efforts to solve challenges related to health and conditions for health in their communities. REACH helps us to achieve that.
Good health is our greatest resource, and REACH has the power to change minds and systems and set communities on a path toward better health.
The vision for REACH is to continue the momentum and spread all the lessons we've learned across this country into many other diverse communities where we can improve the health of the individuals that live there.